Hello, my name is Eric Peterson. I am a consultant for the Upper Connecticut Valley Hospital in Colebrook, New Hampshire on the Substance Use Disorder Patient Treatment Project. So the Upper Connecticut Valley Hospital had identified some need for improving their care of their substance use disorder patients. And through a grant with the Foundations for Healthy Communities, I was hired to help them with that project. We quickly identified the need to connect to the pre-existing resources that were available to us in the North Country. For the most part, what that looked like was connecting to inpatient treatment services and MAT programs. We strengthened our connection with those inpatient resources. We identified transportation need. We identified access based on the most common insurance programs that people carry in our area. And as we improved our connection to the local MAT programs, we started connecting in a more realistic way with the doorway. And through the doorway, we were pointed in the direction of Jennifer Goulet with the North Country Health Consortium.
Hi, my name is Jennifer Goulet, and I'm the Recovery Support Manager at the North Country Health Consortium's Petra Direct Substance Use Disorder Support Programs, which includes the Ask Petra Program, Wellness and Recovery Model Program, Warm for Women Program, and Recovery Friendly Workplace Liaison Program.
Once we had connected with Jennifer, we had identified a need for some stigma and bias trainings to be done with the staff of Upper Connecticut Valley.
They had a goal of training staff to reduce stigma and bias by raising an awareness of what stigma and bias is, recognizing and addressing your own stigma and bias. So we connected and we trained 59 staff members at Upper Connecticut Valley Hospital in stigma and bias reduction, awareness, and addressing it moving forward. From there, we realized that it would be a nice added benefit to start holding community events and really branching this project out into the Colebrook community. So we began holding community conversations where we started talking about substance use disorder, sharing stories, understanding what the community's needs were, and how to best address them.
A project like this in an area like the North Country needs to be done community-wide, and that was identified relatively early on in the project. If we're just educating the people within the walls of the hospital, then this project won't stand a chance for the success that we really hope for. In the beginning of our project, it felt to us like Colebrook was a little lost in the woods. And once we had connected to the North Country Health Consortium, there was definitely a sense of relief since what they could provide to us was a blueprint for how to go forward. They had already been establishing coalitions in the North Country, had been working with local law enforcement. They had been providing stigma and bias education. They basically had been doing all of the things that we looked to do after our assessment phase of what we needed.
The new connection between Upper Connecticut Valley Hospital and the North Country Health Consortium counts in so many ways, not just for the North Country communities, but for other communities as a model. Moving forward, Upper Connecticut Valley Hospital has submitted a letter of interest to become the first hospital system that is a recovery-friendly workplace in northern New Hampshire.
Couldn't have moved forward as swiftly and effectively as we have without them standing by our side basically every step of the way.
Upper Connecticut Valley Hospital is the heart of the community in Colebrook, and now they're bringing the heart of the community back to the community by showing them they care.